If an individual wants to give a kidney to someone else, there's about a 36% chance that they will be ABO incompatible. That is, they may be an A blood type and the recipient may be a B blood type. And so to put an A and a B kidney takes either a lot of work or something else to be done. Now, one of the options that can be done is called paired donation. And that is an instance where I want to give a kidney to you, but we're not compatible. There's another pair that is exactly like us, only maybe their blood types are switched. So I could give a kidney to that recipient, and their donor could give a kidney to you. There's also what's called chains, where there's an individual who's an altruistic donor who wants to give a kidney to somebody, doesn't care who, and they can give a kidney to you. I then give a kidney to the next person, and it just goes down the chain. Here at Clarian, for instance, this month we are starting a chain. We have an altruistic donor who's going to give a kidney to a patient at Methodist. That patient's donor is going to give a kidney to a patient here at IU, and then that will start a chain. The next week there will be 2 more patients done exactly the same way. So one individual then potentially could be responsible for not just 1 kidney donation, but maybe 2 or 3 or 4 or even more than that. Paired donation starts primarily because you have an individual who wants to give a kidney who either doesn't have a donor to give to or their donor isn't ABO compatible. So when that happens, we then look at the options for them, and that again can be a chain if they're an altruistic donor, or it can be just a cross match with 2 other people, or it can be even more than 2 other people. It just depends on how many people are involved. We belong to the Alliance for Paired Donation, which is headquartered in Toledo, Ohio. And if we have a pair, if we have, again, you and I want to give a kidney to you, we go into a computer database in Toledo. And then once a month or so, the computer matches everybody up. So that I may give a kidney to somebody in Georgia, and somebody in Tennessee may give a kidney to you. But it's done in such a way that nobody's disadvantaged. That is, if I want to give a kidney to you, you get a kidney and I give a kidney to somebody else.